Therapy Life Centre. This is kind of like, basically, it's in a nutshell. What do we do that's different? Why are we different from other therapists? Why come to us rather than go to your average chiropractor, osteopath or anything else? The difference is that we, first of all, top priority, we listen to you. We ask you the right questions. We ask you lots of questions. We really listen to what you're saying. And if any of you have been to a GP recently, you'll find that quite refreshing. We also think about the whole person. So as you're telling us all the things that you're telling us, all the questions we're asking, we go right back, even to sort of birth, and look at all the different things that have been happening to you. We actually think about how all those things have affected the problem and the situation. We try and find the root of the problem, and that's why by listening to you and thinking about the whole problem, we actually get to the root of the problem. If you've come to me with a shoulder pain, but many of you won't know, but diaphragm can actually refer into your shoulder. That's something I know and I'm asking questions about. So if you've told me you've had a really bad cough in the last 3 weeks and you've got shoulder pain, I'm going to be thinking diaphragm, but I'm also going to be asking more questions than that. I'm not just going to put my hands on your shoulder and start treating it. We treat you as an individual. Again, I've already asked the questions, I've listened to you, I've thought about you, I've got to the root of the problem, and now I'm going to treat you with your problem, not a shoulder, which is what happens in a lot of places. A lot of people will say they'll go to a therapist and they have the same treatment as their friends and everything else. That won't happen at Therapy Life Centre. And the other thing we do, which we think is very, very important, is we get you to understand how you can take back control. It's not about taking a tablet, going to somebody else and handing your problem over. It's about you recognising how you can keep yourself well, healthy and feeling good. But for me, this is the real essence of what we do. I keep saying the same thing, all of it's important, but this to me is really powerful. And that's we embrace the powerful connection between the body and the mind. It is impossible to separate the body and the mind. Absolutely impossible, barring cutting your head off, which wouldn't work anyway. But if you can imagine, if I had a lemon here now, and I cut the lemon in half, and I took a great big bite out of it, every single one of you, just me saying that, you're probably salivating right now, there's a few faces kind of going like that. Just the thought has had a physical reaction. That's how connected the mind and body is. You cannot stop that. You can't have a thought and not have a physical reaction. You can't have a physical reaction and not have a thought. So how can we treat you as a person without taking that into full consideration? The other thing we do at the Therapy Life Centre, all the therapists there have this ethos. All these therapists are thinking about everything, but also we're aware of each individual person. We all complement each other. We all come in and work together as a team. So if I'm asking all these questions and I'm listening to you and I'm thinking about all the things you've said, and I'm kind of thinking, this sounds more like my acupuncturist would be able to support this better, then that's what we will do. We will refer you over to the acupuncturist. And the beauty is we're all under the same roof. And if I'm not sure, I'll go and talk to her. Look, you know, I've got this patient, they've got this going on, that going on, what do you think? And she might say to me, yeah, that sounds like X, Y, or Z, which might A, enhance how I'm going to treat you, or it may mean that I'll then say, right, this is the person you need to go and see. It may be that you need a little bit of all of it. You know, some people come and they have, you know, a couple of acupuncture, and they come and have some mechanical work with me, and then maybe they go along to one of our rehab classes, so that the whole picture is looked at, the whole person is treated. Again, listening to you, thinking about you, finding the root of the problem, and helping you gain control. With all of us coming together as a team, and that is our really unique selling point. That is what makes us different from anywhere else you go. Most other places you go, you'll maybe have physiotherapy, but then if you want something else, you have to go and find it somewhere else, and you won't have that interconnection that we have at the Therapy Life Centre. I hope that gives you a bit more of an idea of what that means. Let me give you an example of a client that came in. She, I'll call her Jane. She had a horrendous car accident 2 years prior to me seeing her. She'd gone down the usual route. She'd spent an awful lot of money, or the insurance company had, and she was no better. In fact, she was an awful lot worse. She was in severe pain, had regular headaches, was unable to work, was unable to function in any way normally. She had severe anxiety. She also had phobia of driving. Basically, her life was just, nothing was happening anymore. So she started off having some craniosacral with physio combined, where we got the mechanical and the soft tissue work working. One of the things that she'd been told repeatedly was that she was not going to get better. So believe it or not, that's what she believed. So one of the things we had to work on quite strongly through counselling, through lots of different processes, was to actually get her to believe the possibility of getting back to good health. Gradually over the period of time, we brought in acupuncture because part of her was frozen in that moment of the accident. She was literally locked there and still in that high anxious state of that moment of accident. acupuncture through different techniques that they use actually got her away from that frozen point, able to move forward. She then had severe phobia of driving. We brought in Penny. Penny, who does thought field therapy, was able to help her reduce her phobia to the point where she was then able to drive. All the way along, we were still carrying on with the physio, working on the soft tissue. We then started to bring in some yoga treatments, some Pilates, so she was able to rebuild herself back. She is now back in part-time work. She is now back running. She is now back living her life, driving included. And that took us probably about 9 months in total to get her to that point. But as you can imagine, she is over the moon. And that was somebody who had been told repeatedly that this was as good as it was going to get 2 years after an accident. That is how we approach problems. That is how we look at it. We bring the whole team in. Now, one of the things I'm trying to do at the moment, and I'm not allowed to use the word trying, that's against the NLP. One of the things I'm doing at the moment is organising a plan of action. As Helen will tell you, if someone has a car accident at the moment, and I'm using car accident as an example, but any personal injury, any employer who's got long-term sick problems, that kind of thing, this is the sort of plan that we can bring in. But if you have a car accident at the moment, there's medical companies that take over, and they will find you a physio and they'll send you to a physio, and then they may find you a counsellor and they'll send you to a counsellor, and there's no communication between any of them. What we're trying to do now is pull up a plan where we go to the solicitors, we go to the different companies and say, look, send them to us. We will come up with a treatment plan. We may say, you know, £1,000, we can get an awful lot in there. Let's have some physio, let's have some counselling, let's have all the different things I was saying that we gave for Jane. Now, within that, what we can do is, let's say they're having physio and we've budgeted for, let's say, 10 sessions, and after 8 things are going really, really well. That pocket of money can now be put into another area that maybe they need to have work in that needs a bit more help, like the counselling or something else. So by coming to us, we can actually take that pot of money and use it effectively and treat the individual, which is really, really important, which is what doesn't happen. So as you can see, and that brings back the control to them. Because a lot of patients that come to us, one of the things they say over and over and over again is they feel out of control. They feel that they've kind of lost their way. They don't really know where to start. They don't really know how to help themselves. And this is why we do this process, and this is how we get it to work. And I keep looking at the time here to see how I'm doing. I've got more minutes yet. Okay, so I think any questions now, because I can't think of anything else. I've said the main thing I want to say, really. So any questions at all for me?
You talk about the insurance company had spent a lot of money to... Are you registered?
Yeah.
So
yeah.
For all those treatments,
yeah.
you can go?
Yeah, yeah. Everyone that comes to work with me has to have all the right qualifications for their particular body. Some of the things insurance companies don't yet accept completely, like the hypnotherapy side of it maybe, yeah. But then in that particular package we don't have to include that. We've got other things that we can bring in to support. The nice thing is that for most conditions there's 2 or 3 things that we can do. So if they won't accept one side, we can always bring in something else. And also, the more, as we start to move this forward, the more evidence we bring forward, then we'll be able to start asking for those things. But everyone who works for me is registered within their profession, if you like.
How many therapists have you got down there?
15. But they're all, different times and everything else. Sorry, Kevin first.
Kevin, the question for you is, if someone they believe they can come and see a therapist, how do they do? What's the process? Do they come to a consultation first of you, or do they see you and then you refer them straight away?
I mean, obviously, this example I gave was like an extreme example. Yeah, obviously, the majority of people that walk through the door, they come in, often they phone up. Most people know where they want to start, so they'll either phone up for physio or they'll phone up for acupuncture or whatever, and that's where the therapist will, once they've assessed them, decide that really is the right thing for them. Other people phone up and they don't know what they want, so one of us will phone them back and have a chat to them and get a feel for what they need, and then decide who's the first person for them to come and see.
Do you charge for a consultation period for that,
yeah.
for the initial?
Yeah, yeah, yeah.
You do?
Yeah. Because there's never a time they won't have some form of treatment. It's not just questions and answers and that's it. There's always some form of treatment advice. It's a real sort of full session. They'll go away with a greater understanding of what's going on, usually with some treatment and usually with some good advice as well. So yeah.
Do you have a plan of action for that? Do you sort of look there and go away and say it's going to take a year or it's going to take...
Every single person is treated individually. So yes, but I normally you say, this looks to me like this, this and this and this is going to happen. So we give them a really good idea. But it helps more if we've actually... usually a couple of treatments before you can start to see how the body's going to respond. the mind is massive, and it depends on how they believe they're going to be as well. It depends what's going on, and there's layers, and the more you work with people, the more you get to see what the layers are, and so that kind of can change, but we're always very upfront with people, and one thing we don't do is overtreat. So it's literally, if anything, people will be told, go away and give us a ring if you need to come back and see us.
Last question.
This is probably not much of a question really, but I have, it's a testimonial really, which I shall put in writing to you. I haven't quite worked out how to word it really. Karen treated me with craniotherapy how many months ago, I can't remember now. And on that first session it was kind of I think you lifted 26 years of pain and anxiety from an accident that I had in one session, that I was unaware that was in there, and it was quite amazing really. If anyone has ever had anything that could be subconsciously deep within, seriously, you know, you've got to go and see it.